Hello, good afternoon, good morning, good day to everybody that's joining us live. So, thank you so much for coming in to join us for our next hot topic webinar. Today, we are going to be talking about the utilization of the violet laser in veterinary medicine. We have Dr. Starr, who's going to be presenting on the lasers, and she's been using the lasers in her clinic for about 12 to 13 years.
Yeah.
And so great success, and she's really very passionate about how this violet laser is the most underutilized tool in veterinary medicine. So she's going to be sharing a great presentation today. It's going to be quick. We're not going to take up too much of your time. Of course, if you have any questions at all, please feel free to reach out to me. My name is Malia Ellis, and I am the veterinary sales manager here at Erchonia. So I will be your contact for anything about the veterinary side of things. We do have a really great promotion for the month of February as well, so stay tuned. We are going to be announcing that in the later part of the presentation. But again, it's not going to be very long. We're just going to give you some quick information about the laser. And of course, contact me if you have any questions or if you'd like to take advantage of that promotion. Without further ado, I'll go ahead and pass it off to you, Dr. Starr, and we'll go from there.
Thanks, Malia. So I do think that violet laser is the most underutilized tool in veterinary medicine because of it has so many unique characteristics that other wavelengths of light do not have. And though the other wavelengths of light have their unique characteristics too, but not many people know about violet laser. And so I am going to go through mostly just those unique characteristics today. I'm not going to go in depth into the physics of laser therapy, even though I enjoy the physics. So let's get started. So when we're talking about how laser therapy works, we are looking at targeting the electron transport chain in the mitochondria. There are 4 complexes there, and then ATP synthase there on your right. So these 4 complexes pump protons across the membrane to create a gradient, and then that comes back through ATP of proton gradient, and then that comes back through ATP synthase to create ATP. So when we look at what the absorption spectrum is in these in the electron transport chain, complex 1 and complex 2 are both absorb violet wavelengths of light. And I'm going to go through this in a minute. And then 3 absorbs green light. And then complex 4, the current accepted theory is that absorbs red light. And so in order to even start the electron transport chain, we need complex 1 to be working well. And that can be really important because if we get shut down at complex 1, then we are not going to be able to get much ATP production. So you can look at violet laser as getting it going. It's really important because that violet laser can help reverse inhibition at complex 1. So this is complex 1, and it's NADH or NADH, and this is a molecule that has the ability to absorb a wavelength of light, and this is its absorption spectrum. So you can see it's in the low 400s is where it peaks, and then it rapidly drops down. So this 405 nanometer wavelength of light is right there around that peak. This is complex 2. This is FAD, or FAD is the part of this molecule actually of complex 2, which is succinate dehydrogenate, that absorbs that wavelength of light. And this is the absorption spectrum for FAD. And there's some here down in the ultraviolet range too, but that ultraviolet light is ionizing and can be damaging. So we do not want to use that therapeutically ever. Because that's in the dangerous light waves. If you do want to, like, if you watch my physics lectures, then I talk about that there, but we don't want to use UV light. So, but then we have this other peak here in the 4 to 450 range. So we are getting complex 2 with violet light as well. Complex 3, I'm not going to talk about because that's green light. But however, It has two absorption peaks. In the biggest one is in green light, but it has another small absorption peak in violet light. So we even get some absorption in the violet range on complex 3 as well. And then this is complex 4. And this is where the accepted theory is that this is where red light works. However, this paper came out in 2019. It was written by Andre Sommer. And in this, he theorizes that red light does not work, red into near infrared does not work because in complex 4, because the absorption spectrum is actually flat there. This is the wavelength of light that it does not absorb. And to your right here, you can see this is the published, this paper here down, this is the published absorption spectrum for cytochrome C oxidase, which is complex 4. And you can see again, there's that peak in the early 400s. There's 410 right here, so 405 would be right next to it. This is where we're getting the majority of absorption in complex 4. He says that red light works. This one's I'm just going to let you know, red light works too, but it works in a different way. And he talks about red light working through the interfacial water layer, and the fact that it isn't absorbed is why it works really well, and it decreases viscosity in the interfacial water layer, and that protons can flow back across the membrane through ATP synthase more effectively, and that red light actually probably works at ATP synthase. So essentially, we can, to some extent, affect most of the electron transport chain just with the violet laser alone. So laser applications, when red and violet pair really well together, because what I said earlier about, violet helps pump those protons across the membrane, and then red helps bring them back across. So here we get a full cycle. If we pair red and violet together, we get even better responses therapeutically or clinically. And so red and violet paired together have been shown to be more effective at relieving this. These are Erchonia's studies to get FDA clearance. In the human side of things, they can get FDA clearances. We don't need that in veterinary medicine, but they have that in human medicine where they do studies to prove efficacy. They are double-blinded, randomized, and controlled. The control is LED light. So when we pair red and violet together, so their red light has FDA clearance, and the red and violet also has FDA clearance. However, when the red-violet overall, both groups were responsive, but the red-violet was more responsive than red alone. So again, we affect more of the electron, or we affect the electron transport chain with violet, and possibly, ATP synthase with red. So we get that whole cycle when we pair red and violet together. Therefore, the red-violet laser together works quite well. So therefore, any application for red laser is probably also an application for violet. And I'm talking about musculoskeletal and dermal conditions. I think standardly, we should be using laser on musculoskeletal and dermal conditions. If you do nothing else with a laser where it hurts in musculoskeletal issues, and we can get resolution. Oftentimes, wound therapy with red light has been shown to be very effective. And I'm going to talk about why violet is a wonderful adjuvant to red light in dermal therapy. And then there on the bottom, green and violet paired together were even more effective. We don't have green available yet in the veterinary market, but they do in the human market. And Erchonia had to, again, do those FDA clearances in order to get for back and neck pain. To get an FDA clearance, they had to do studies, and the green violet together was even more effective at relieving pain, back and neck pain. So what does a violet laser do? So the violet laser increases nitric oxide levels. And so this study here on the bottom, this was the conclusion of this study, but it has indicated that nitric oxide appears to be significant concerning the antiviral activities, antioxidant, and anti-inflammatory properties related to relieving disease-related symptoms. And so this release of nitric oxide really boosts the immune system for antiviral activities. Well, that's actually killing viruses directly, but also in increasing an immune response so that we get both an increase in immune response and we can kill, we'll get into the antimicrobial aspects of it, but also increases antioxidant levels and is anti-inflammatory. So this, the role of low-powered blue laser in the wavelength of 405 nanometers in increasing the level of nitric oxide, in increasing resistance of cells to the virus COVID-19 and its effects on virus COVID-19 mortality in vitro. So they were finding that cells that they were attacking with COVID-19, that violet laser helped to protect them. So, and then there's several studies done on using, especially in broiler chickens, and using a green and blue. When it says blue, just so you know, whenever you're looking at studies, if you're a PubMed junkie, kind of like I am, and you are looking up studies for whatever you might be looking for laser, many studies refer to the 405 nanometer wavelength of light as blue. Blue, violet, whatever it's referred to as, look for the wavelength of light. It's probably in the violet range, but it might be blue. It could be up in the higher 400s, but blue and violet are used interchangeably in the literature. So, so if it says blue, this was 405 nanometer light, by the way, in this study. So even though it says, and even down here, it says in this study on the bottom. So we increase immune response and we decrease cytokine release when we use the violet laser. So violet blue light activates NRF2 signaling and modulates the inflammatory response of THP1 monocytes. So here they even put violet and blue together. This was a 405 nanometer wavelength of light study also. So that 405 nanometer in the literature can be referred to as either violet or blue. But overall, the violet is really, really good with infection because we're increasing immune response and decreasing inflammatory response, or excess inflammatory response, not healthy inflammatory. We're not going to get rid of an inflammatory response. We're going to decrease an excessive inflammatory response. So violet light is also directly antimicrobial. And this is where I really feel like we should be using it more and more. We talk about antibiotic resistance all of the time, and we could really do a lot of damage to bacteria, fungus, and viral with 405 nanometer wavelength of light. So I'm just going to go through studies on each of these things where they've found it to be and how it works. So it is directly antibacterial. So this study, the efficacy of pulsed 405 nanometer light emitting diodes for antimicrobial photodynamic inactivation. So this one was an LED, but they were using it on surfaces to decrease the load. It was effective against Staph aureus, very important, right? MRSA is one of the things that we worry about as far as antibiotic resistance goes. So effective against Staph aureus, and it had the same efficacy at 16 joules per centimeter squared dose. So this is the dose. So over time, in all the groups, it was the same as long as they applied 16 joules per centimeter squared. So intensity, frequency, and duty cycle did not matter. So this means it doesn't matter if you have a 1 milliwatt or a 1 watt light. At 16 joules per centimeter squared, it was going to be effective. So if we have lower power over increased time, we have less hazard to cells and eyes, but we are equally effective. So using this dose, we can use it very safely at very low intensity. Frequency in duty cycle have to do with blinking the light or pulsing the light. And they were not important. Again, this is in vitro, in killing Staph aureus bacteria in vitro. So this is another one that I want to talk to. This is where they talk about using 405 nanometer light in order to try to decrease incisional infections post-surgically for orthopedic procedures, is the recommendation of this paper. So they talk about 405 nanometer light has bactericidal effects on a wide range of medically important bacteria, and it reduced bacterial bioburden when used as an environmental disinfectant method in a burn unit. Therefore, and so they designed this study to look at what would be a safe range to use for post-operative lasering of orthopedic condition, for orthopedic surgeries. And so they use intensities of up to 5 milliwatts per centimeter squared. So remember, the other one is joules per centimeter squared would be the dose. Milliwatts per centimeter squared would be the intensity. They were able to use 5 millis for up to an hour, had no effect on cell morphology, activity of alkaline phosphatase, synthesis of collagen, or osteoclastin expression. Demonstrating under these conditions, this dose is the maximum safe exposure for osteoblasts. So specifically looking at osteoblasts, they could leave that 5 milliwatt on there for forever, and it had no problems. But when they got up to 15 milliwatts per centimeter squares, they started to get the osteoblast function were significantly decreased, and viability of osteoblasts was not influenced by exposure to 2 milliwatts per centimeter squared for even 2 hours. So at 5 milliwatts per centimeter squared, they find high intensity light is an effective bactericide. It killed 98% of Staph aureus and 83.2% of Staph epidermis. So overall, we need to, the really important thing about violet light, because it's such a high, energy wavelength of light, we want to keep this at low intensity. We don't want to get into, you know, a watt of power. It's way too much. We want to do real low power with violet light. So how does it work? So this is a paper on how violet light kills bacteria. And so what they did here was they did imagery of the cell membrane, and then they irradiated the cells and they looked at them again, and the images obtained revealed 3 major effects of pulsed blue light. One, there was a disruption of the MRSA, and they use MRSA. There was a disruption of the MRSA cell membrane. 2, there was an alteration of membrane structure. And 3, disruption of cell replication. So it changes the membrane structure and keeps them from reproducing. So here's another study that is looking at a wider range of bacteria, let's say. So wavelength and bacterial density influence the bactericidal effect of blue light. Again, this is a 405 nanometer. Well, it did 405 and 470. Blue light on methicillin-resistant Staph aureus. So this MRSA. And they had a 405 nanometer and a 470, but the 405 penetrated bacterial colonies better because it's more energy, killing a greater percentage of MRSA. And here again, they found low doses were effective. There was not an increased benefit to higher doses. So here we have another violet 405 nanometer light. This one encompassed a bunch of different pathogens. So they had 4 different resistant bacteria that they were looking at. they had beta-lactam antibiotic-resistant E. coli, and they actually found that it was the most sensitive to 405 nanometer light. But they also looked at MRSA, Pseudomonas aeruginosa, that's a big one for us in the veterinary community, and Staph pneumoniae. So if you have those Pseudomonas ears that you can't do any, I mean, you can't find a product, right, in order to treat them with, this is something that we can use to help kill bacteria that is resistant to that. When you get a resistance profile and you're like, what am I going to do with this? This is an option. So biofilms. So biofilm formation increases the efficacy, decreases the efficacy of antibiotics and antifungals. So when we look at biofilm formation, you know, you might be familiar with biofilm formation in the gut. You might be familiar with biofilm formation in bladder infections, where we're having a hard time penetrating biofilm with antibiotics, and therefore we're not getting resolution of infection. But 405 nanometer light has been shown to be effective against biofilm. There's certain bacteria are far more likely to form biofilm. Candida is a big one. I know it's not a bacteria, it's a fungus. We're going to get into that next. But Streptococcus, Staphylococcus, and Pseudomonas, and then they find that when these bacteria are in combination, we're even more likely to get biofilm formation. So I just put a couple of papers down here that are about using 405 nanometer light to penetrate biofilms. So antifungal. So we just talked about Candida forming biofilms, and we know that the light penetrates biofilms. So I'm not going to go into Candida a whole lot more. But ringworm, it's been shown to be to kill ringworm, susceptibility of trichophyton mentogrophites to visible light wavelengths. So we get good kill in ringworm. And then there's a paper down here also on malesthesia. So ears, again, we combat malesthesia a lot in veterinary medicine. This is another big infectious agent that we see all the time that we could be using 405 nanometer laser in order to combat. It is antiviral. So this is effective against HIV in plasma. So this study was done looking at using 405 nanometer, and again, see violet blue, they put both of them there because some refer to it as violet and some refer to it as blue. This one, they were looking at trying to eliminate HIV from human plasma in blood banks. And so they're using it as a disinfectant agent. So can it be used surface-wise as a disinfectant? The 405 laser can even be used on surfaces as a disinfectant. If you don't want to be exposed to a lot of chemicals, if you're one of those people, you could be using your 405 nanometer laser to disinfect your OR. And then this is a paper to the right here about that just talks about, or in the study they found that it killed COVID-19. SARS-CoV-2 is COVID-19, and that it also was effective against influenza A. Those were the two viruses that they studied, and it did kill both of those viruses. So I think, here's another thing. I think had we only had these lasers available in our ERs across the United States when we were going through COVID-19, perhaps we could have saved more lives. And this really, we've already gone through a lot of this. This is a paper that is just talking about, we know that violet light is antiviral, and that the present treatments are focused on virus removal, tissue oxygenation, and reduction or inhibition of cytokine storm caused by severe inflammation, right? I mean, people were drowning in their own fluids. This was severe inflammation, cytokine storm that people were dying from in COVID-19. And we can reduce cytokines with the violet laser. We can increase the immune response with violet laser, and we can kill virus with violet laser. And so doesn't that make this the optimal tool to be using when we're coming into that kind of a situation with severe lung inflammation? So they, in particular, were looking at using no more than 2 milliwatts because the high energy of this wavelength should not exceed, or because of the height, this wavelength of light is so energetic. We don't need power when we have energy. And the smaller that wavelength of light, the more energy we have. We don't need to worry about power. And again, they bring up the nitric oxide there in that last sentence too. Reduce inflammation of the lungs and increase the amount of nitric oxide that will increase the body's immunity and improve oxygen delivery to the blood and tissues. Increases parasympathetic response. So what are we seeing now, right now in the United States that kind of looks like that, right? We are seeing canine infectious respiratory disease complex. So we currently have an outbreak of this, though maybe it's dying down a little bit on the east and west coasts, getting maybe a little bit more, spreading around a little bit more. We don't even know what it is. Is it viral? Is it bacterial? How do we treat it? We don't know how to treat it. We don't know how, but we don't have to know how to treat it to use violet laser on these dogs. And I think that we should be using the violet laser on these dogs. It's decreasing cytokine storm. It's antibacterial. It's antiviral, or if it's fungal, it's even antifungal. We don't know that yet, right? So for all the reasons that we have given for treating COVID-19, we can treat canine infectious respiratory disease complex without having to know what is causing it. And perhaps we can save some of these dogs' lives or prevent lung scarring, increase quality of life, and get them to turn around a lot faster, not get them to progress to the point where they're severely ill. So I just threw in one case study here to talk about the dermal aspect of things. I said I was going to talk about the derm. So in pairing red and violet light, red is fantastic for tissue regeneration and wound healing. And violet is good for immune system and killing bacteria or fungus or virus, whatever you got going on there, that is the problem. And so when we look at pairing those two together, we're able to help get rid of infection and help with tissue regeneration at the same time. So this is Georgia, and I'm pretty sure we were very limited in finances for Georgia. So I didn't get to biopsy this. I'm relatively sure she had autoimmune disease, and you're looking at this poor dog going, oh my God. But what I want to, there's a couple of things I want to point out. In the picture to the left, she's hunched, her head's down. She's non-weight bearing lame on that front left leg. Yes, the joints were swollen. That's one of the reasons I think that perhaps we have autoimmune disease. I think she may have also had a polyarthropathy. But this is a miserable dog. Her tail's tucked. And she had been, at the point that I started lasering this, she had already been on antibiotics for 4 to 6 weeks. So I know I saw her 2 weeks. I put her on antibiotics. I saw her 2 weeks later. She was somewhat improved. I gave her another 2 weeks of antibiotics. She came back in and she hadn't improved at all. And so we were looking for other avenues to treat this because her owners did have limited finances and we weren't getting anywhere with antibiotics anymore. And I couldn't send off a culture and do all of that. So we did a 12-minute violet red laser on her whole body. And you can see these big open wound areas. What you can't do is run your hand through the back of her neck where she had little spiky scabs all over. This was not just in, these areas. It was all over her neck and head and in other areas of her body too. And so we lasered her and she came back in, and I only lasered her once for 12 minutes every 2 weeks. And this is after 3 laserings. So again, she is not, I wish I'd gotten her tail in here. Her tail's down now. She's not all tucked up. Her head's up. She's weight bearing on that front left leg. As a matter of fact, if we look at, you know, it was really swollen before, and now the swelling has come down significantly. You can see she's healing on the shoulder, the middle, the picture in the middle is the shoulder, the picture in the to the right is her hind leg. And I had taken her, in case you're wondering, did the antibiotics find the kid? I had taken her off of antibiotics when I started lasering her, because I don't like to continue to kill off a microbiome if I don't have to, and I clearly wasn't getting anywhere with antibiotics. So at that point, this is what I was, that's not true. I put her on, but she was on that in the beginning too. I started with herbal antibiotics, and then I moved to broad spectrum antibiotics, and she was still taking some herbal antibiotics at this time. But the only real change that I did was I lasered her. Again, 12 minutes with the red violet. I did 12 minutes because there's clearly, you know, if I'm trying to kill bacteria, I'm going to go longer period of time. And she responded quite well. I did need to continue. Just so you know, I also think this is autoimmune disease, because I did need to continue to laser her, or she would break out, she would start to get sores again. So that's all I have for you today on violet laser. If anybody has any questions, I would be happy to answer. Looks like there is some maybe in the Q&A.
Yes, it looks like we do have one from Dr. Karaman. So if we wanted to maybe do that one verbally, and then I'll switch my screen out while you are doing that.
So what is meant by using venous laser as an intravenously? Yes. So there are some people who do, or there is a practice of lasering the blood. So we can, in human medicine, they do place venous lasers, and they are running the laser through the bloodstream. It is intravenous. Does that answer that question well?
I think so. If anybody does have further questions, feel free to add those into the Q&A box for Dr. Starr. I'm going to go ahead and do a little bit of a presentation here. It'll just be really brief here, but I wanted to kind of compliment everything that Dr. Starr did such a great job with. And I know, Dr. Starr, you had some really great studies in there as well. So if you wouldn't mind sharing your presentation, just like the slide parts, you don't need to share live or anything, but that way I could get some of these articles to the attendees as well. That would be fantastic. But just to reintroduce myself, again, my name is Malia Ellis. I'm the veterinary sales manager here at Erchonia Lasers. So I want to kind of go into a little bit about the laser, and then we'll show some testimonials, and then we have a great promotion for you as well. Dr. Starr did a great job going into details about the information on the applications, as well as the research and the mitochondrial side of things. So for here, I wanted to kind of showcase this because this slide really shows the electron volt potential. And we're talking about what's being absorbed in the mitochondria. The electron volt potential is so important, because when we don't have very much energy, we really don't affect the mitochondria. And as you saw those graphs where you could actually see the peak absorption for different complexes on the electron transport chain, it is very specific. So when you're looking at like an infrared laser, even on the low spectrum of like 800 nanometers, the electron volt potential is only 1.5. When you look at the violet over here, you're at 3.1. So that is more than double the energy going into the body. So very much like Dr. Starr pointed out, that it is not about power or penetration when you're talking about photochemistry. It is talking about low dosage and absorption. So high energy is very important, but we do not necessarily need the high power, because that just really can overstimulate the tissues. And if you want to see some more information about that side of things too, we did a webinar about a month ago with Dr. Dave Huff that you can reference on our on-demand page that goes into the differences and the basics of the physics of lasers with photochemical effect versus photothermal effect. So that's a great place to kind of see. And if you want access to that, you should have access to the replay link already, but if you don't, we'll make sure to get you that. The next thing I wanted to kind of showcase is we did talk about the electron transport chain a little bit already in the peak absorption here. What I'm just going to say as simple as possible is when you're talking about complexes 1 and 2 here, where the violet is working, this is responsible for 40% of the ATP production in the mitochondria. You're putting in the violet plus the red, which is working over here, complex 4, which is an additional 20% of that electron transport chain stimulation. So we're increasing that ATP production by up to 60% when you're using the combination of the violet and red lasers together here and really increasing that ATP synthase. Really important that you know that. And then obviously we have the added benefit of that antimicrobial effect. Now we do have a basic laser that's just our red by itself, which is a fantastic device. It's great for pain and inflammation, cellular healing, communication, and it will upregulate the immune system. But when you're talking about all of the extra benefit that you get with this violet laser, it is so much more valuable by adding that in there, which is why the EVL laser is the most popular Erchonia veterinary laser. This is a great article too here. This is just showing that the mitochondrial complex 1 is a central regulator of the aging process. Complex 1 has a central role in the regulation of longevity. The generation of the ROS specifically by complex 1 correlates with the levels of oxidative damage in mitochondrial DNA. Long-lived animals are associated with a complex 1 that leaks fewer electrons and produces fewer free radicals. So as we are really focusing in this veterinary medicine, complex 1 is the key in being able to heal this mitochondria and start that ATP production as well as everything else. So it's really, really important. So this is what our EVL looks like here. It's small and handheld, you can see here, and being used. And if this is your first exposure to Erchonia lasers, you can see here that you do not need to wear goggles. We are a visible light laser. We are class 2. It is considered a non-significant risk. It is not required to wear goggles. It is completely safe. The only true contraindication is to not shine it directly into the retina. Outside of that, you are completely fine. But the violet and red laser, our EVL handheld, which is what we're really focusing on today, has both our red 635 nanometers as well as the violet 405. Violet has an antimicrobial effect, but this laser can do everything that our VLS basic laser can do, but faster. And you have the added benefit of that antimicrobial effect. You're also going to get a tremendous balance of the parasympathetic and sympathetic nervous system and really kind of creating an equilibrium between those two. And we talked about this already with the complexes 1, 2, and 4. We're increasing the ATP production by up to 60%. So that is truly phenomenal. And we have the best pricing of the year right now that we are actually offering $3,000 off of this laser. It's the most we've ever discounted the laser. And that brings it down to the $12,900. Now, when we're comparing the lasers together, this is from our human clinical trial from chronic neck and shoulder pain. This is just with the red by itself versus the red and violet. So when you're actually looking at this, sorry, my bar is in the way here. So let me move that up to the top here. So with this, you're seeing that the duration of pain is longer with the red and violet patients, and but the overall pain reduction was quite a bit higher with that 75% reduction. And the increased range in motion is almost double the red and violet combination versus just the red by itself. So in a pain and inflammation or a just musculoskeletal condition, this is just showing you that when you're comparing those two, the red and violet combo really does have even more potency and more of an effect in the body. Here we have a great article as well. This is for the violet laser being used in antibiotic-resistant MRSA cases. The light actually photo destroys the MRSA. Dr. Starr did share this study as well. So this is the one that I was mentioning in the chat. So if anybody did want this, I will send this out to you as well. But the 405 having the bactericidal effects on a wide range of medically important bacteria, and it's reduced bacterial bioburden when it's used as an environmental disinfection in medical burn units. So another key point, Dr. Starr already hit on this, but 5 milliwatts is where you're actually having no negative effects on the cell morphology. But once you expose it at 15 milliwatts, 15 milliwatts. So when you're talking about the actual exposure of this, with the violet light, it's very important to keep this in very small dosage. And Erchonia only uses a 5 milliwatt violet laser. Our red laser is at 7.5 milliwatts. So the two of them together are very low power output because we just do not need that. Dr. Starr went in really great detail with that already. I wanted to show you guys some of this before and after in clinical outcomes that we've had here. We do have, for our Erchonia veterinary laser owners, we have a Facebook group. So a lot of people really like to share their outcomes here. Here it was a cyst removal, and then the surgical staples failed. So you can see the wound before and after, and this is just 3 hours in between. You can already see the tissue regeneration right there, just immediately within 3 hours. No additional treatments from that. Here, we're going to show you another great one. This is actually from the Facebook group. Again, this is from a tissue sarcoma, and you can see the day of surgery, 7 laser sessions, and then 10 laser sessions of that, which is 17 days post-op. So tremendous amount of healing. We're really expediting the outcomes here for that. This is a great one. This was actually just shared with me about a week ago, or a couple weeks ago. You can see February 1st here. So this was a colt that was supposed to be euthanized, and it was really traumatic. She actually reached out to me and said, how do I get some treatment? So I actually connected Dr. Connie with one of our equine specialists, and she got some specific protocols to go ahead and do this. But this colt had gotten sick in November with watery diarrhea. After 3 weeks, had recovered from colitis and rejoined the herd. But around 8th of December, he was quite lame with abscess-like symptoms. And then basically they were doing antibiotics, flushing the wound with antibiotics at separate times. And then overall, they recommended euthanasia on the site. Now, the Guardians decided that they did not want to do that. They wanted to look at some other options. And thank goodness that they did. They brought him to Dr. Connie. And with that, they went ahead and started doing treatments on January the 4th. So this was at the EVL laser. And he started showing improvement very quickly. He was much less pain, the less pain medications were needed, and it appeared that he needed to have the hoof to grow out naturally. Blood tests within a week showed that the infection had been completely resolved, and a specialist farrier had been consulted for assistance with trimming while the foot regrows. Follow x-rays will be taken shortly as well. So these are actually just the progression photos that they shared as well. So you can see here on January 5th and then January 7th, where we actually started to use it. You can see the decrease in the inflammation tremendously right there. And then overall with the healing of this infection as well. And then now we're starting to see this hoof regrow and actually saw the trimming here. So, I mean, it's really phenomenal, the outcomes that you can expect from this. There's a lot of applications. I do want to also point out our base station, because our base station is already a 17% savings. So we don't ever discount this, but we are going to be offering, ignore the June part here. This was a previous slide that I edited here. But the violet laser special that we're doing right now is we are actually taking $1,000 off of each EVL laser that's included in a base station. So a base station gives you multiple applications. You can treat 3 different lasers and 3 different patients at the same time. You can treat 3 different areas of the patient with the lasers at the same time, or you can treat in your office passively, but then also go ahead and send the lasers home as a rental unit and get that really great return on your investment with that as well. So this is completely customized, and we do have the promotion for that. You can always build into this. So if you already have a VLS laser or you already have an EVL laser, this incentive will still apply for any EVL that you add up. So instead of the normal $4,000 upgrade, it would be only $3,000 to upgrade to an EVL laser. So it's a great option for this. That's just, I wanted to kind of put that out there. So again, we have the best laser pricing of the year right now. This is going to be good till the end of February, and then it does end. So then it'll go back up to that normal list price of $15,900. Just to kind of give you a breakdown, if you just did the single EVL, you're saving $3,000. That brings it to $12,900, and that's $275 a month if you're doing financing for up to 60 months. If you did a base station traditionally with 2 red VLS and 1 EVL, normally it'd be $29,900, and then that is already going to be a $5,800 savings, but we're taking that additional $1,000 off because you have 1 EVL in there. So you're actually saving $6,800. That would come out to about $617 a month, and I'll show you the breakdown of return on investment for that too, because doctors are easily renting their lasers out for about $800 a month or $200 to $300 a week. So even just renting one of your VLS lasers out will pay for your entire base station. Now, if you did the base station with 1 upgraded, so you'd be saving about $9,800, only $681 a month. And if you did the deluxe version of the base station with 3 EBLs, that one you're going to be saving almost $13,000 by doing this. So you basically are getting a free EBL when you do this base station promotion right now. And that's $745 a month. So again, even just renting one of your lasers out at $800 a month already covered the entire monthly payment. And then you still have 2 lasers that you're actively using in clinic. So again, it's the biggest price discount of the year. This is the best opportunity for this. We kind of went over the numbers, so I'll skip forward about that. Quickly, I'll talk about the implementation of a laser rental program, which basically gives you a passive income for your office. You're going to be looking at 6 to 12 treatments in office about 2 times or 3 times a week, just depending on the flexibility of your parents. But the parents may not be able to get to your office. If you're doing equine, you may not be able to get to the farm or to the facility to be able to treat them quite as often. So this gives you the flexibility to get those treatments in closer together and heal faster. It's a great opportunity for your pre and post-operative patients, for acute injuries, chronic conditions, traumatic brain injuries. We'll probably do a little bit more on the hot topics going forward on traumatic brain injuries and sympathetic calming with lasers. As we continue to do these webinars, keep communicating with me. Let me know what topics you want to see, what you want to learn more about. If there's a specific type of protocol that you'd like to see with the lasers, we want these to be catered to you. So we may even just do one specifically on laser rentals and the passive income. But this is great for rehab options, busy professionals that can't get to you all the time, and families that have multiple pets. So we kind of went over these numbers already, but like I said, $200 to $300 a week. If you have a specialty practice, you may be looking at the specialty price of like $700 a week, but you're looking at a weekly ROI with rental program from anywhere from $9,600 to $33,600 by just renting one laser out a week. If you do it on a monthly basis, like I said, $600 to $800, you're looking at a yearly revenue about $7,200 up to $9,600. So it's a great return on your investment and being able to increase the overall passive income that you're getting, but also pays for that entire base station or gets you another item on your wish list. Here's a breakdown of the return on investment. If you're just doing 5 patients a day and you're only charging about $30 a treatment, which is on the low end, honestly, of the national average, but just for the sake of keeping things simple, you're looking at anywhere from about $30,000 annual revenue up to about $86,400. So that's just treating 5 patients a day, and that's in a 4-day work week. So just in summary here, why Erchonia? We're the most research laser on the market. We have 22 out of the total of 26 FDA clearances. We're by far the most energetic laser in the market, and there's no contraindications or side effects ever in the history of the device. It's a completely fear-free option. There's no goggles required to wear, no loud noises, no large devices, no cords, and you can treat from a distance. With those line-generated beams, you can actually treat larger surface areas as well. There's never any heat that will ever be produced. It's completely programmable, even though it does come pre-programmed for ease of use, and it is a cord-free portable option. I do want to pinpoint here that we have Dr. Starr doing a full 4-hour CE course. That's going to be coming up in July. So July 27th, save the date. If you do want to register, here's the QR code. This will take you directly to the registration page. She will be going into a lot more of the physics of the lasers to the applications. She'll be going into advanced protocols that you can do with the lasers, lots of before and afters, and truly start to finish protocols. It's going to be a great event. It's completely free, and it is going to be on live stream, so it'll be available for everybody there. And then the last thing I'll mention is that we just relocated to our brand new headquarters in Greenville, South Carolina. We are going to be doing a fantastic grand opening party, and we would love to have you join us. We'll be doing facility tours where you can actually see the labs and the areas that the lasers are developed and produced, made and manufactured there. We'll be doing a great dinner and cocktail party for this as well. So if you'd like to join us, please let me know. I can send you this as well, but you can scan here to register for that as well. If you are interested in the lasers or would like to learn a little bit more, if you just want to schedule a virtual demo, or if you would like to take advantage of the Violet laser sale, this is my contact information, and I'm the only veterinary sales manager with Erchonia, so I'll be your contact for everything. It looks like we do have quite a few things popping up through the chat. It looks like Dr. Starr, you're going through the questions on there, so we should be good there. Is there anything that I am missing here? It looks like we should be good to go on my end. So is there anything you've seen, Dr. Starr, that I need to pop in for?
Somebody did, and look at the Q&A, there's a question about the EVL and charging. I answered it, but you might be able to do a better job.
Sure. Let me see if I can find this real quick. Oh goodness, I may have to scroll for a little bit. Let me see here.
It's in the Q&A.
It's in the Q. Oh, in the Q&A. Okay. Can the EVL be used if it hasn't been completely recharged? Yes, absolutely. So that's a great question. On the EVL laser, there is a standby function. And when you get the laser, Dr. Millette will go ahead and do that. Let me know when you have it in your hand, and we'll go ahead and schedule that Zoom meeting so we can get you fully trained on that. But with that, you can use a standby function, which will actually put it in kind of like a sleep mode. But as long as it has some charge, it'll turn on. So with that, you just, if you have it not on the standby mode, and you use it start to finish, you probably would get about 3 to 4 hours of continuous use with the EVL laser before you would need to fully charge it again. Now, if you do have a full charge and you use the standby feature in between uses, you're going to get through a full entire day and you won't have to recharge it in between uses. So hopefully that answers that question. But of course, anytime somebody does purchase a laser, let me know as soon as you do get the laser. I'll send you an email with some information to get you started. But then I like to schedule a full Zoom meeting for everybody to go over the basics. I'll also look through the Q&A chat after the webinar closes.
Yeah,
I'm just
gonna, are you okay with me just answering these questions?
Sure.
I picked for everybody too. I typed in a response, but
yeah.
So one was using the red violet on Staph aureus positive mastitis cow. Yes, I would laser the udder for 12 minutes. I put a protocol in there. But I'd start with a 12-minute lasering, see how she responds. I think that getting inflammation down is really helpful, is also for milking and getting milk out and draining the udder. And on top of that, having that antibacterial effect, it's a good adjunct. I wouldn't only treat with that. I would also treat, but you could probably have a lot faster response. And then at the bottom, another question, is it also good for eye problems? I do use my lasers, my Erchonia lasers around the eye all of the time. I have even used them when the intent is to laser eyeballs themselves. I shine the light from the side, from the in towards the eye. It can be uncomfortable to an animal to shine the light directly into their eye. It is not going to hurt them, but I wouldn't shine the light directly in their eye. We come from the side. The light goes systemically, so you're going to get a higher dose wherever you're shining the light. So around the orbit, wherever you want to do, you can do that. I do a fair number of sinuses too, run it right between the eyes, but they move their head all over. The light goes in their eyes. It doesn't injure them. So I hope that answers those questions.
Yes, absolutely. And if there's anything that didn't get answered, we can definitely have these conversations offline. Dr. Starr is always very gracious about if you need to speak with her, especially, she can always hop on a call with you, or I can help with any of those things as well. But let us know what questions that you might have. And thank you so much for joining us today. It was a great hot topic webinar. The next one will be coming up in the middle of March. I'll email everybody on this webinar the access to that as well. But that one I think is going to be on wound healing. So that's going to be a great one too. But thank you everybody so much. Thank you, Dr. Starr, for a great presentation. And we will look forward to having you all join us at the next one.